Hi everyone, today we're going to talk about climate change and its relationship with infectious diseases in our community. So, a little bit of background, as we all know, climate change is not just an environmental concern, it's a growing public health crisis. Things such as rising global temperatures, changing precipitation patterns, and increased frequency of extreme weather events have all created favorable conditions for the spread of infectious diseases. We need to understand how climate change exacerbates infectious diseases in order to protect vulnerable populations in our country and ensure public health resilience. So, there are four main ways that climate change affects infectious diseases. The first way is through vector borne diseases. So, rising temperatures and altered rainfall patterns have expanded the habitats of disease carrying vectors, such as mosquitoes and ticks. Diseases that we've learned about, like malaria, dengue fever, Lyme disease, and West Nile virus, are now emerging in regions that were previously considered as non endemic. Warmer climates accelerate the life cycles of vectors and pathogens, and thereby they increase transmission rates. Another way is through waterborne diseases. So, flooding and heavy rainfall caused by climate change can overwhelm sanitation systems, and they can then contaminate water supplies with pathogens such as cholera, E. coli, and Giardia. Warmer water temperatures also promote the proliferation of harmful algal blooms that produce toxins affecting both marine life and human health. A third way is foodborne diseases. So, higher temperatures increase the risk of food contamination by accelerating bacterial growth. These include bacteria such as Salmonella and Listeria. Supply chain distributions can, due to extreme weather events, can also compromise food safety and availability. A fourth way that climate change affects infectious diseases is through respiratory infections. So, wildfires, increased air pollution, prolonged allergy seasons, these are all linked with climate change, and this can all contribute to higher incidences of respiratory infections like pneumonia, asthma, and COPD. So, why is this a problem? So first, there's an increased disease burden. The increase in diseases places additional strain on healthcare systems, especially in under-resourced and rural areas. Two is health disparities. So marginalized communities often face higher exposure risks and have less access to healthcare services, thereby exacerbating existing health inequities. Lastly, we have economic costs. Treating emerging infectious diseases incurs significant healthcare costs and economic disruptions due to the lost productivity. So, what can we do about this? One is strengthening the healthcare infrastructure that is in place. We can invest in rural healthcare facilities with strong telemedicine capabilities that can improve access to care and disease management. We can also enhance the surveillance systems that are in place for early detection and response to infectious disease outbreaks. Secondly, we have to put in time towards our community and patient education. Educating our community on climate-related health risks and preventing measures through public health campaigns is necessary. We can also empower patients with knowledge about vector control, hygiene practices, and the importance of vaccinations. A third way is through policy and advocacy. We need to be advocating for policies that address climate change mitigation, such as reducing carbon emissions and promoting sustainable practices. We can also implement zoning laws to prevent residential areas near high-risk flood areas. Lastly, is collaboration and research. So we can encourage partnerships between healthcare providers, policymakers, and environmental scientists to develop evidence-based interventions, and we all need to work together as a team. We can also support ongoing research on climate change and infectious diseases to adapt public health strategies effectively. In conclusion, addressing the intersection of climate change and infectious diseases requires a multifaceted approach that includes strengthening the healthcare infrastructure, educating our patients and our communities, and promoting policies that help climate risks. By prioritizing both prevention and education, we as healthcare providers can play a critical role in building resilient communities capable of withstanding the health challenges posed by a changing climate. All right, thank you guys.